Hi, Dr. Nurse Podcast. Welcome, Tammy, to the podcast today.
Well, hello. Thank you for having me. I love the opportunities like this to kind of tell my story and my journey in nursing to hopefully encourage others out there to pursue their dreams in nursing or even a change in their clinical specialty.
Love that. And I love what you're doing. You are doing some cool stuff, and you've done even cooler stuff being a flight nurse and just things that we haven't had on the podcast yet. So I'm super excited to hear all the things that you've done in your career and kind of how you led up to the spot that you're in today, which I believe you're kind of part-time locums or just getting full autonomy over what you want to do because you're so specialized and you're so in need that you can just be like, I'll give you what I can give you, which is just incredible spot to be in. And you worked really hard to get there. So I can't wait to hear about it.
No,
Let's take it from the top.
okay, sounds good.
So tell me a little bit about kind of like I was saying, what your current role is, kind of what you're doing for a living, how you divide your time and your different roles.
My main role now, obviously, is a neonatal nurse practitioner, and I have been in nursing overall for 30 years. First 10 of it I did in the NICU. As you said, I was a flight team nurse for 6 years. I was a NICU bedside nurse for 4 years. I even had a short stint for a little over a year in the PICU, but then decided after my 6 years and as a flight team nurse, which is a whole nother realm of nursing, very specialized, which I enjoyed greatly. If anyone out there has an interest in it, I suggest that you talk to someone who's a flight team nurse. Maybe if there's an opportunity in your healthcare organization to shadow someone, that would be awesome, because my institution, we do a lot of services. My home-based institution, we do ground, fixed wing, jet, and helicopter transport. So we have 4 modes of transport. Baby, not just our tertiary center, like bringing babies from outside communities in my area to our children's hospital, but also we do transport out of the country. We go and pick up children, from out of the country and bring them to us, and even from one state to another that a hospital organization may hire, so to speak, our institution to move a patient from one organization to another for NICU specialized treatment. So, but after 6 years of doing that, I decided that maybe I want to step away from that, and I went back to get my master's and become a neonatal nurse practitioner. That took me I'd say 3 years. It was 3 years. It felt more like 5. I actually started out in orientation with one child. And by the time I graduated, I was pregnant with my 4th one. So that was a journey in and of itself.
Oh my goodness.
It was crazy. It was crazy.
Did you have twins in there?
No.
Oh my gosh. How?
Number 2, 3, and 4 are very close together. There was a lot of crying. I'll just leave it at that. A lot of moments where I said, I can't do this. I'm quitting. I had an awesome advisor. My husband was incredibly supportive and basically said, listen, tomorrow's going to come whether you're in school or not. So you might as well just finish it. And side note, we've spent a bunch of money for you to do this, so you need to finish it. So, but he was awesome. He was very encouraging because he had to pick up a lot of slack at home. And, there are a lot of people who want to do that, but they're discouraged because they don't maybe have a significant other who's willing to help them while they pursue their dreams, or maybe, people at their workplace are not very supportive. And I want people to know from my message overall that there are people out there that will help you. Even if they're not in your workplace or in your personal life, there's somebody there that you're not aware of that will help you pursue your dreams, whether that's just encouraging you through school or helping you if you have children at home that need taken care of while you pursue your dreams to make your life better and still do what you want as a career aspiration. But once I did that, I got out and I worked for a while here at my home hospital organization.
Let me stop you real quick. Your neonatal specific or specialty, that is a completely separate degree from like a peds nurse practitioner or like,
Completely separate.
Okay, so you are only neonatal,
Only neonatal.
or can you do peds?
Only neonatal.
Okay.
Because you have to be certified. So now it's a 4-year, you have to have a BSN, then an MSN. Your MSN has to be a specialty in neonatal nurse practitioner. So
Does every school offer that?
not
'Cause I
every,
don't think every school offers. Yeah.
every university offers that.
Yeah.
Anyone's interested, you can always contact me. I'm on Instagram, nurse to NNP, nurse to NNP, and I will direct you to where you can go to investigate your options as universities. But you have to be in a program that specializes in neonatal nurse practitionership. That is an actual degree, yes. Just like in peds, there's acute and as well as primary care. Those are two separate
Yeah.
degrees in a master's program. NICU is just the one for a neonatal nurse practitioner. But then when you graduate from that accredited program, then you sit for your boards. Yes, you do have to take another certification. It's through the NCC, the National Certification Corporation. Once you pass that exam, then you're off and running.
Gotcha.
So
Okay.
that
And so you said you went back for your master's, sat for boards, had a bunch of babies when you were in school. That's insane. And then that's insane.
Right. So then got out and worked for probably, let's say, 8 years. And then I decided, you know what? This isn't really working for me because my kids were still fairly small and I needed more flexibility in my schedule. And long before the pandemic, long before everyone was like, I'm going to do travel nursing, I was traveling as an NNP, which people don't realize nurse practitioners traveling is different than nursing because so much goes into working as a nurse practitioner, regardless of your specialty, because you have to go through the board of nursing, the medical board. You have to have a DEA. In some states, you have to have a controlled substance certification as well. In some states, you have to whatever organization you're going to work for. If you're traveling there as a locums, that's what they call it when you're a nurse practitioner, PA, or physician, then you have to go through credentialing at the hospital, which is basically, I tell people, it's basically a vetting process. So, and that generally takes anywhere from 30 to 90 days, depending on how fast that you do that. As opposed to a nurse, you just have to get your license in that state, and then you go to an agency, they present you, the hospital says they take you, bing, bang, boom, you're working there. It's not that simple when you're working as a nurse practitioner. And that's
as a
not
provider.
including, they have to clear your national provider identification number. There's so many things that go into it when you're working as a locum. So I started dabbling into working as a locums, and I love the idea of going to different hospital organizations to see how they practiced. Did that for, kind of on the side. So I was full-time at my home hospital. Then I went in my home state. Then I went part-time, and then I went PRN after doing locums for 2 years. Cause I said, you know what? I can get as much work as I want or work as little as I want and do my own schedule. I can make my schedule flexible for me. And I know people are always interested. They're like, wow, you really did? I was like, yeah, I've been doing this for the better part of 8 years now.
Do you think that you've got a lot of options because you are so specialized in the fact that you can set your own schedule? If you're super broad, I feel like maybe there's less options, but because you were so niche down, do you think that you've got more options?
Well, I think I'll tell you, I'll be honest with you, because I get people contact me because they just see nurse practitioner. They don't even see neonatal nurse practitioner. And once you work with an agency and they present you at various hospitals across the country that have openings, obviously with your permission, your name gets floated out there. I have companies that I've never even worked for send me jobs for things that I don't even have a specialty in, like psychiatry.
Interesting.
Urgent care. I'm like, I am a neonatal nurse practitioner. Thank you for the offer. So there's so much out there. And I tell people who are nurse practitioners, regardless of their specialty, or those who want to pursue a degree in a nurse practitioner specialty, that go ahead and do that and then get out there, get your bearings, work for at least 2 years uh, in one setting and then learn as much as you can. Because then, if that is your goal or something you may want to dabble or pursue, then try doing locums. Because I I personally have had a great experience, not just in I don't have to ask anyone for PTO. Make my own schedule. When I want to work, I work. When I don't, I don't.
It's amazing.
Now, I know some people are like, well, what do you do about insurance and whatnot? You know, I don't have to worry about that. I'm very fortunate that my husband has excellent insurance, but there are companies out there who just do like the ones I work for, because most companies that do just physicians, PAs, and nurse practitioners, they don't do nurses because it's so specialized, and getting them credentialed
Yeah.
through the process is so much more advanced. And I don't want to say advanced, more complex than
You're saying that getting nurses and using
Yeah.
nurses is more
It-
complex than
physicians,
providers?
PAs, and nurse practitioners into another. It's a big deal for them to get me. It's harder. It's
Yeah, it's
lot of
harder.
paper.
Yeah.
Like, I'm getting credentialed right now for
Got you.
an organization in Arizona. And you wouldn't believe, just this morning before this phone call, I had to go and do a drug screen. Then I had to do that. And that's just a, a little things today. That's not all the paperwork that has to go through, because they have to present me through credentialing. And I just finished and got all my information back from the Arizona Board of Nursing. So now I'm going through the medical board. So it's a whole process. But if you want to get back
Got
to
you.
my original point, go with a staffing company once you're a practitioner and you're out, worked for 2 or 3 years. They have options where you can get insurance through them and they have full benefits. I just don't need that portion of it. Right. My husband, who does have a financial background, so he we run me working as a locums, and at home I work PRN at a lot of local hospitals. We run it like a business. We
What do you mean?
yes, if you
How do you mean that?
let's say if I was full time, they would take out taxes, I would have benefits, I would contribute to a 401k. I don't have that anymore because PRN, well, they obviously take out taxes, but like I don't work with the W-2. I don't work like that with locums. So we manage all of my
Sure.
finances like it's a business.
So how many hours a week are you working? I mean, if you're
Well,
PRN,
the home hospital, like my home
I'm sorry?
hospital, so to speak, I'm not working there at all this week. But say today I'm not working. I haven't worked since last Friday. I flew home. So I have been off. I will fly back out on Wednesday and I will go to another state to work Thursday and Friday. And then I will fly back on Saturday.
So how did this work when you had little tiny babies and were you flying out or were you just
I-
doing PRN?
I dropped to part-time and then I started working locums. Like, I would work one day at home and then fly out and then work 2 days someplace else and fly back late that night.
Oh,
It
wow.
was at
That had to be tough with kids. My goodness.
I did it for about a year. And then my husband's like, yeah, we can do this. We can do this. In fact, it'll be better if you do this because, when you're at X hospital, you're working around everyone else. They're telling you your schedule. No one's telling me. I work like, no, if a
Mhm.
hospital asks me, well, hey, we need you to work 3 days this a week. And I was like, well, it just depends on the day because it's how you set up. I do shift work. I don't do contract work. I've been at a very well-known hospital organization. I won't mention the name, obviously, for the better part of 3.5 years. And I basically make my own schedule. I work at several of their hospitals. prior to coming to this organization 3.5 years ago, constantly calling my staffing company and saying, well, is she available? Can she do this? Is she available? And they come to me, my staffing guy, and I said, no, I cannot possibly do that. I can't, because I'm not going to because that would defeat the purpose of why I'm doing this. I get the hours that I want. I work the days that I want.
Yeah.
I work
Because
very few weekends. So if I work a weekend, it's because I choose to work that weekend, not because I have a weekend requirement. I still get to do what I love.
That's incredible.
I learn so much from different institutions because I can see, I'd like to say, at this institution, they do that.
At this institution, they do this. They do this over there. Yeah.
Good outcome, or, they have a better outcome than this organization. So it's really a learning experience almost as much as it's a convenience for me. It's a benefit for me. And that's what I tell people all the time on my lives is that nursing is so flexible, guys. You can do anything, and you can make it work for yourself. So when I hear people or they contact me and they're like, oh, well, I just don't know if I can do it. I don't know if I can do this, or how would I do that? You won't know until you try. And your options are in abundance, especially right now. And I definitely wouldn't say go to school and then come hop right out. I would not, me personally, I wouldn't recommend that. But it's definitely an option. And I think if you're someplace where you're getting a lot of experience and truly are enjoying what you're doing and you feel that you could benefit from the flexibility, I definitely would encourage somebody to do it in any specialty once they've gotten at least about 2 years of experience as a practitioner. So.
Gotcha.
Mm-hmm.
So I was a couple things came to mind when you were talking. One of which was, I was wondering how you got started in the NICU and neonatal and why you chose that field. Because I was thinking again, everyone gets a calling and has a dream and they this is what I meant to do. And it sounds like you've been pretty laser focused from the time that you graduated as a nurse in treating children and taking care of kids. And that's been something that you've liked from the beginning, which I think is great. I think that a lot of nursing programs, kick out nurses and they're like, you have to do med surge. It'll give you get your feet wet in med surge, but you really just kind of laser focused in on, this is what I really, really like, which I think is really cool. And can you touch on, how did you discover that this is what you wanted to do?
First off, if not everyone knows what they want to do right when they get out of school, and that's out of nursing school, and that's okay. That's completely okay. But for me, I'll be honest, when I was in nursing school, my first thing was, I'm going to be an adult ICU nurse. That was what I was going to do. I was going to be a CV ICU nurse, work with cardiac patients. That's what I was going to do. Loved it. And when I went through that rotation, but then I had my peds rotation. And peds, I really liked it, but then we got to go to the NICU and we only spent, I think, 3 days in the NICU. And I was like, I love this. This is what I want to do. I love this. And I got, because, I went to nursing school quite some time ago, nursing 30 years. So you guys can do the math. But all my instructors were like, well, you'll have to be in med surg first. I was like, okay. Well, when I graduated, just before I graduated in my home city, I'd come home one weekend and my mom had told me that she had heard that there was a program for nurses who were going to be new grads at my now hospital, my home hospital, shall I say. And so I called them up and they were like, yes, we have a peds residency program. And those that are accepted in the program, they'll rotate through various peds units, such as the general pediatric floor, peds rehab, newborn nursery, the pediatric ICU, and the main NICU and the NICU step down. So there are 6 areas. So I was like, ooh, I want to apply. And they were like, okay. So I applied. I was lucky enough to get in because not every
pick me
got in. Obviously they have a limited spots. So I was lucky enough to get in.
Sure.
All the rotations. definitely liked some more than others, loved the NICU.
Oh, that's
So at the end of the rotation, they tell you that, the nurse managers will come that have spots open and offer those who they are interested in spots. And if you desire, you can take that spot. So I was like, oh, please let the NICU person like me. Please let them like me. Well, I didn't get a call from her. I didn't get a call from her.
Yeah.
I got a call from the PICU, newborn nursery, and one of the peds floors. And so I was kind of disappointed. So I ended up taking the pediatric ICU job. That's where I was for my first year and a half. But then
Yeah, that's where you were. Yeah.
passing one day, I was actually in the elevator and I saw the nurse manager and I was like, should I ask her? Should I ask her? And so, because she had said hello. And so I asked her, I was like, oh, do you know if you have any positions coming open soon? Because I'm really still interested if that would be an option for me. And she said, oh, well, actually, we would love to have you. And I would have loved to have taken you. And it wasn't because they didn't like me at all. It's because they had no position. So she was like, if one comes up, we will call you. So probably about 6 months later is when she called. Someone had went out on maternity leave and it was only part-time and it was on night.
Cool.
So she said, will you take it? I was like, I'll take it. So that's how I got into the NICU. I got certified in peritoneal dialysis for neonates there. Yeah. Learned to put in PIC lines.
Oh, for little babies.
And then I was in the flight
Oh
team.
my gosh. You just got in and you just had such a lucrative, not just like lucrative, a very fulfilling and rewarding career. It's something that you weren't initially picked for and that you went back and were like, no. This is my calling. I know this is what I meant to do. And so you circled back. You didn't let it go. I love that.
And you don't know unless you ask. And if they say no, you're nowhere before. And I remember I was this little fairly new nurse. Well, I was new. I was at that time, I think maybe 6 months, 6 or 7 months. And I asked her, I was like scared. I was like, here's this nurse manager of this huge NICU. What do I say? And I was in the elevator with her and I asked her. She was like, yeah, sure. If something comes up, well, definitely. We just didn't have any positions open when you came through the residency.
I think it's neat that if you would have been like, well, they didn't want me, I wasn't good enough. If you were living in that mentality, then you would have never had the strength or the courage to ask. And then to find out that it wasn't anything about you. They just didn't have positions. And so it's like, yep, I would have been, but like listening to this imposter syndrome or whatever negative mindset. And it wasn't the truth. It wouldn't have been the truth. So I just think that's such a great lesson. I think that's a really good message for nurses to hear, just not to give up. One of the other things I was thinking about while you were talking along your path, and again, one of the things I like to encourage nurses is to create mentor relationships, finding people that you can learn from. I do hear that you often throw yourself out there. Like, if you're interested in this, give me a call, reach out. Has anyone done that for you throughout your career? Have you had any mentors, or are you really into mentorship because you didn't have mentors?
I really had someone when I was starting out as a nurse practitioner, a neonatal nurse practitioner, who was really my biggest advocate. Well, 2 people outside of my advisor in my graduate program who were like, you can do this, because I had a manager as an NNP who really wasn't one of my fans. We'll just leave it at that. And this other manager at one of our sister hospitals was like, she reached out to me. Actually, the medical director, his wife reached out to me and said, hey, we have this position at one of the other hospitals. Do you want it? An NNP position? Because her husband, she said, he really wants you to take it. And I said, yes. So this person who was the NNP coordinator reached out to me. She was my biggest advocate. I can't even tell you. I love her. I affectionately call her my white mother. She gave me the best advice. I tell people all the time is, if you listen to the voices outside your head, they will become the voices in your head. You create the voices in your head. So
Come on. I like that line. That is so good.
because I had got in my head what this other manager said, and it was her because I grew as a clinician, as I grew as a person, because I didn't. And now I honestly, when I see this individual who wasn't my fan, still probably isn't, but she's still at this institution and still a coordinator of NNPs at our main children's hospital. I honestly want to thank her. And I don't mean this being sarcastically. I mean that sincerely, because her lack of support is what drove me to where I am today, because I have some of the best hospitals in the country that people come from all over asking me to come back. Medical director, love where I am today. I have no regrets, zero regrets about my past. I mean, I would tell the then Tammy that, girl, you have no idea what your future is ahead. There are tons of people out there who want you, not just to fill a position, but because they see your worth. They see your worth.
And that typically is kind of the last question that I ask, is a piece of advice you give back to your younger self to hold on to, and then a piece of advice to toss. Because again, kind of in that state of, okay, what do I wish I would have known? What do I wish I would have not listened to? You've kind of answered that question about, I wish that I would have told my younger self, like, it's going to be okay. Like, and I love how you describe that nothing happened on accident. Everything that was meant for you came to you throughout your career. And I wanted my listeners to know that since you do locums and you're not kind of at the mercy of one hospital, how's your pay? Because I really want a little more pay transparency for nurse practitioners. And that may make people uncomfortable, so you don't have to say numbers. But it would be nice to know, like, okay, no, working my schedule as a locums, I'm making more, less, or the same.
If someone offers me 95 an hour, they're kind of lowballing me. And I determine what the acuity is of the NICU that I'm working in. For a look, no, I'm not. No, I'm not.
You're kidding me.
That's lowballing me. That's a little low.
That's lowballing you. $95 an hour.
No.
Okay, full transparency. I make $52 an hour.
No.
That's insane. You make almost double what I make.
But like
an hour. That's insane.
Let's just say $90 an hour.
That's incredible.
You still have to take my taxes out. Okay. My husband always says, and my husband is a former CPA. He is a project manager. He has a very extensive background. I know. If nothing else, I
like your husband. Yeah.
Even if you are getting paid more than what you at home, just a little bit, let's just say just $10 more. What is your time worth? You're not asking anyone for PTO. You're scheduling yourself. You're not involved in any of the unit politics. He says, you think of yourself as a hired hitman. You come in, you get the job done, you leave. You're in, you do the job.
You're mercenary.
That's it. You're not going to staff meetings. You're getting your time back. That your time is valuable to him. He says that all the time, and people don't think about that.
You need someone in your corner reminding you of these things as you pursue things that might be not the norm or a little more uncomfortable. I mean, it's not comfortable to travel.
I want people to know, if you are considering locums as a nurse practitioner, first off, yes, you're going to be away from home, and that's something you need to. It's uncomfortable to go to a new hospital, learn a new EMR, to be in a new setting, learn new policies. I always tell people, don't even worry so much about the policy. Worry about your clinical practice, because trust me, the nurses are going to tell you you're doing it wrong, and it'll be easy for you to figure out. The thing that I remember most is, yes, I'm always sleeping in my bed. I still have as my travel person at the staffing company, because they book all my flights. She was like, honey, you can literally buy every seat on the plane. And that's not an understatement. She said, and you would still have points left.
Do you get to pick your hotels? You get to pick your hotel?
If there's one close by.
So if you're like Hilton only, baby, that's all I stay in.
The only one that they don't do is Marriott, and only because Marriott, you still get the points. Marriott,
What?
you have to present a card
That's like a Ritz
of check-in, and they won't. My company doesn't do that. They pay prepaid. Hilton will do that. But if I want to stay at a Marriott, I can stay at a Marriott, pay for it, and then submit it, and then they give me the money back. Yeah. They pay for my rent-a-car. The only thing I have to pay for the car is the gas. They even pay for my toll.
What about like food and like,
what they they'll give you like,
do they give you a stipend?
Dinner voucher. Every day you work, like, you get $20.
Okay.
$20 for the day.
How many days out there do you do like in a city?
It could end up being like 6 days or 5.5 days, because I got to fly out there the day before. Then I work, 3-4 days. And if I don't fly back,
The travel.
the 4th day that night, if there's not a flight, depending on what time my shift is over, then I have to fly back first thing that morning. So I keep all that in mind, because again, I don't want to, the money is fantastic.
And that is the Doctor Nurse Podcast. It's all about creating the life that you want, because so many nurses are burned out and tired and exhausted, and they think, I've got to just keep sitting at this table and eating this food. There's no other options for me. And I'm like, oh no, we have a buffet. Like, go put that plate back, go get you another plate. Like, because there's too many options. You shouldn't be unhappy. And if you are, you just need to move yourself, because there's just so many things you can do. And this is, again, another one. I've had another locums nurse practitioner on, and she again said a very similar thing. I feel like I work for myself. And a lot of the things that she was describing, you've also touched on, that you've got to be a little more proactive with certain things that you typically kind of leave on autopilot and you don't really pay attention to. But I think when you're invested in how you're investing your money, when you're invested in, okay, so how much taxes am I paying? And you start to see these numbers, it's kind of like, it doesn't just come out of your paycheck in your sleep. You're like, I pay what in taxes? Okay, we need to get somebody else in office because this is too much. You know what I'm saying? Like, it does start to make different decisions, look at things differently, because you are managing this stuff by yourself. And so it's not a bad thing. It's not a bad thing. It's the smart thing to do, because you're totally aware of what's going in and out. You're managing your life more so than just letting it kind of just happen on its own. So I actually kind of like what you're describing. If I didn't have a baby, I would probably be travel nursing right now, because it just seems like such an incredible thing. My husband works from home too. So it's like, you could just pick up and go. We could go someplace every week and be someplace new and be traveling, because it's so wonderful. But I think for children, they need a level of stability, and I don't want to be away from him any more than I have to be. So that might not be the thing for new moms or moms of littles, but it might be a thing for moms that are, their kids are a little bit older. And so it's like, whatever, I could do locums here or there. And I've been reached out to do locums urology, because there's just not a lot of neurology nurse practitioners.
It was hard enough, believe me, going to school when they were all so little, because I was gone so much. And but I don't know if I could do it. I probably could do it a little bit when they were little, but not at the extent that I'm doing it now, because I wouldn't want to be away from them that much. But yeah, so I personally encourage everyone who is thinking about nurse practitioner to reach out to a nurse practitioner in the specialty that you're interested in, even if you're not quite sure if that's what you want to do, because I am a huge, huge advocate of mentorship, because there were so many good ones there are so many good ones out there, and I had 2 amazing ones. So I would not be doing them justice, because they reached out to me and they helped me. And listen, I'm getting older every day. We all are. So I'm not going to be doing this forever. So I need more NNP, and I'm especially trying to get more nurse practitioners in general of color in whatever specialty. Obviously, I have a key interest in neonatal nurse practitioner and anything for that matter, maternal health. But I want more people to consider their options. Don't feel like you're trapped. You never know unless you try. And for goodness sakes, do not let people guilt you into burning yourself out on something that you love. And if you love it and you get burnt out on it, I promise you, you're not going to like it. I've been doing this for 30 years now. And believe me when I say, and people always say 30 years, oh my gosh, please no one say that. That people who loved it that I worked with and burnt themselves out, and now they're not even in nursing, including neonatal nurse practitioners, NNPs.
You burn yourself out to the point where you leave something that you love. And that's how you protect. I think that you protect yourself from burnout by listening to yourself and determining, I'm not happy at this place. Because there's a trifecta, right? Like there's the right boss, the right job at the right time in your life, right? And so if you are somewhere out of line on that trifecta, it's not going to work. Like the job isn't going to be perfect. You want all of them to be aligned. And so it can be the right job, right? But you have a really bad boss, kind of like the story you were describing before. It was like this woman just didn't like you and you're like, I don't understand. And so this other person came in and then you were in the right job with the right boss at the right time. Boom. You were happy. And so again, if you are, okay, that sounds really cool. That sounds like a really good job. It's the boss sounds great, but I'm a mom of a little and I can't do that. So now there's a misalignment with the, you know what I'm saying? So you have to be at that right sweet spot.
Your life isn't working for your job or profession. And that's where people get confused. And now I'm a little bit older, a little bit wiser. And I know if it don't work for my life, then we can't work together. And if you keep that perspective in your mind and you learn to use the word no when appropriate, you'll be okay.
Yeah. 100%.
Yes. You have to, your work and your profession has to work for your life. You focus on your kids. You know, we can't make every event that your children are in or that someone, a special event that your loved one has. I get it. But you shouldn't feel that you are missing everything or you're so exhausted you can't participate in anything outside of work. So that's not good.
That's really good, Tammi. Finding that work-life balance by listening to your heart and realizing and knowing that the truth of nursing that we want to plant today is you have options. There is an abundance of opportunities. Do not let yourself be miserable and burn out from a career that you love. Don't let it happen. You have to protect that. You have to protect your peace. You have to protect what you love. And if a job is taking you and making you not love something that you know you love, then it's time to go. It's time to go do something else because I love this and I know that I do. So this must not be in that triangle for my life right now. So I got to go because it's not lining up. Thank you for coming on today on the podcast and sharing your story